Well, thank you very much for being here with us today. We're going to talk about psychopharmacology issues with police and public safety personnel, particularly involving fitness for duty evaluations, but also general performance issues. Now, this program is spearheaded by Dr. Turner, James Turner, and he's provided leadership and direction. My name is Clark Smith. I'm a medical doctor. I'm board certified in addiction psychiatry, also in forensic psychiatry, and I'm the medical director of a drug and alcohol treatment program in San Diego. It's called Sharp Vista Pacifica Hospital. And we treat patients there with chemical dependency problems and also with concurrent psychiatric problems. I want to go over some objectives. We're going to talk about the most commonly prescribed medications prescribed by primary care physicians, internists, general doctors, the medications that you will likely see in officers or anyone that you evaluate for a fitness for duty evaluation. Now, some of these are psychotropic medications, many of them, but they don't necessarily have to be prescribed by a psychiatry specialist, although that's what I do and that's my area of focus. We're going to talk about how these medications affect specific job skills of police and safety personnel, public safety personnel, making life and death decisions on an instantaneous basis based on limited or incomplete information. In other words, a very high level of cognitive function is required and a level of alertness and stamina that is above and beyond what we see in most job descriptions. Participants will be able to discuss the impact of these medications, particularly regarding pain control. Very important issue. Many people you see will be on some sort of pain control management program. And if that involves medications that cloud consciousness or cause withdrawal, then obviously that can affect performance, and we'll talk about how. I also want you to be able to talk about strategies for dealing with problem situations internally. In other words, avoiding fitness for duty evaluations. Often employee assistance programs, counseling, sometimes just a kind word and a day off are all that's necessary. But when that doesn't work, then we need to be able to do an external evaluation or a fitness for duty evaluation. And we will also talk about non-addicting medications for treatment of pain and anxiety disorders. This is something that is a tremendous focus in my treatment of patients because they've already proven to have addiction problems. It's not ethical to put them on addictive substances, and yet they have real problems with either pain, depression, anxiety, usually all three at once. And so it's an interesting issue. It's really what I do on a daily basis, and I hope it will be interesting for you as we talk about it.